Morning. I'm Debbie Robinson, Warden of the County of Renfrew. In April, on behalf of Renfrew County Council, I addressed our community and spoke about ways we could all stay safe. We did everything possible to keep COVID-19 at bay in our county, and we were successful. Today, I'm asking you to once again take up the challenge. The second wave is here, and the number of positive cases is rising. It is my pleasure to introduce the other members of our panel who will share their respective messages as we all work together to keep everyone safe. Minister of Natural Resources and Forestry, the Honorable John Yakubuski. Mayor of Pembroke, Mike LeMay. Acting Medical Officer of Health, Renfrew County and District Health Unit, Dr. Robert Cushman. Clinical Coordinator for the Renfrew County Virtual Triage and Assessment Center, Dr. Jonathan Fitzsimon. County Emergency Management Coordinator and Chief of the Paramedic Service, Mike Nolan. And Brittany Martin, Community Health Nurse, Pandemic Advisor for Pikwakanagan First Nation. As we watch the number of community cases of COVID-19 rise in Renfrew County, we felt it was necessary to speak with our residents to both reassure you that everything possible is being done by your local healthcare sector and your municipal and provincial governments to keep you safe, but we cannot do it alone. We need your help. No doubt we are all experiencing some level of COVID-19 fatigue, but we need you to understand that letting your guard down now will give this virus the opportunity it needs to surge forward and take lives with it. I realize that we all want our independence back, that many of us are just tired of being told what to do, where to go, who we can and cannot see. But let's be clear, ignoring the rules puts not only yourself, but others at risk. Your desire for independence does not eclipse your neighbor's right to be safe. There are guidelines from medical professionals and public health experts that are non-negotiable. They are created to keep everyone safe and they must be followed. We are witnessing the impact of ignoring directives and how that has impacted on other jurisdictions, and we don't want to see that happen here. The residents of Renfrew County did everything right. We accepted the lockdown, the closure of business, the isolation from family and friends. It was extremely difficult, but we contained the virus. We won the first round. This fight is not over. We are in a key place facing new challenges. We must recognize that individual vigilance and strict observance of public health recommendations are imperative. The health and safety of your loved ones is in your hands. We need to constantly practice the fundamentals: hand washing, physical distancing, and masking. If you are sick, stay home. Keep your social bubble small. Stay informed by frequently visiting the Renfrew County and District website. So it is my pleasure to introduce Dr. Cushman.
Thank you, Madam Warden. Many of you have heard from me before, and I'd like to just give you an update today. We've had more cases in September than we did in March, and we also had a fair number at the end of August. In addition to that, we've had to close a high school, the first school to close in Ontario. What does this tell us? It tells us two things. One is this is the second wave. The other one is that we've got COVID fatigue. Well, unfortunately, we cannot afford to have COVID fatigue when the second wave is here. And that's why I'm giving you a very, I would say on one hand, a cheerleading message today, but on the other hand, a very stern message today about how important this is. And yes, we all have COVID fatigue, but guess what? Come and work with the health unit for a day, or join the VTAC staff, or go along with EMS for a day. Careful, careful, careful here, because we're burning out and we need your cooperation. We need your cooperation to observe all the rules as the warden has said. Now, I'd just like to touch on a few things that are extremely important. To use a football analogy, the public, you are the offense in this battle. You are the ones that can hold the virus at bay. We, the health professionals, are the defense. Once it gets into a long-term care, once it gets into a hospital, once it gets into a school, once it gets into a house, that's when we do the contact tracing to prevent further spread. But you are the ones that have to keep this virus at bay in the community. It's so important, and we're relying on you to do this. Otherwise, we're going to close our schools, the economy is going to shut down, And our hospitals are going to be overcrowded yet again with people who are sick with COVID. And we don't want this to happen. Yes, wash your hands carefully, dutifully, frequently. Yes, wear a mask and do the physical distancing, the 2 meters. Often a combination of the two is good. But I have two other very important messages for you. And this is what we've seen recently. If you have symptoms, you have to go home, you have to self-isolate, you have to contact us, and you have to keep your family at home. One member, the member of the family with symptoms, needs to be tested. And this is so important. What I've seen in the past few weeks is people who have actually been moving around, traveling, visiting people, doing their work with symptoms. And often they write this off to a previous medical condition, seasonal allergies, for example. We cannot afford to do that. Please, 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 if you have symptoms, stay home and do what we've recommended. And the other issue I want you to address is your social bubble. Our bubbles are getting too big. We have to really think about this and restrict their size. Extremely important. And you've seen this with some of the measures that have come from the province recently. So as I said, we're counting on you. We can't let down our guard. We need your cooperation. We need you to really look in the mirror, think about how you can pull up your socks, and to a small percentage of people, I would say it's time to get with the program. Thank you.
Thank you very much, Dr. Cushman. Now we'd like to speak. I'd like Mr. Yakubuski to speak, please.
Thank you very much, Warden Robinson, and also thank you to the other members of the panel this morning. I really want to reiterate some of the things that Warden Robinson and Dr. Cushman have said, because they bear repeating. Nobody wanted this to happen, but the second wave, or what amounts to the second wave at this point, we all predicted that it was going to happen and come forward at some point. And Dr. Cushman alluded to the fact that and Debbie as well, that there is COVID fatigue. There's no question about it. If you're out in the communities, you see that, and people are getting tired of practicing safety measures. But what's happened in the past few weeks, not just here in Renfrew County, but all across the province, all across the country, has shown that this is far from over. It is a long way from being defeated. COVID-19 is a silent enemy that creeps up on you, and when you let your guard down, it will strike. And these numbers that we're seeing are very stark. So to the people, and I did some public service messages last week. We can't sit back and believe that it's over, or think that measures that everyone else takes, or the government, or the health unit, or the different levels of government, the county or municipalities, are going to stop this. It really is an individual responsibility as well. I mean, what the health unit is doing a tremendous job of managing the issue, getting people tested, and getting a handle on it when there is an outbreak. But it's up to us, the people, to ensure that we are doing the right things. The measures are there, the advice is there, the hand washing, the social distancing, the masking, the maintaining a reasonable size of bubbles. But I can't emphasize enough, we have done a lot of things at the provincial level, and I know that Dr. Cushman and I have spoken many times. We met with the Board of Education the other day as well, locally, as well as the Minister of Education, to talk about things that we can do to improve our protocols within schools. These things we can do, but everybody must take charge as well. We have to accept that regardless of what it looks like when you're walking around and everything looks good, it doesn't take long. And if one person gets infected and continues to involve themselves in what they consider their normal circles, whether it's work or social circles or otherwise, that's going to spread. So Dr. Cushman's advice about, it's not just advice, it essentially is an order that if you are feeling ill, you must get a test and self-isolate until those test results are returned. Now that's something that we recognize we're challenged on, getting those test results back in a timely fashion. I had a meeting with our Jobs and Recovery Committee this morning. Minister of Health, Christine Elliott, was part of that meeting, and we are doing things we can with regards to also in enlisting public and private labs to try to improve our ability to get those tests back in a timely fashion. But that's not that's important, and we're doing what we can, but we have to make sure that we are doing the things we can to stop the spread. So we're in this 100% together. And it's a joint effort, a community effort. We've done tremendous. I mean, I'm proud of the people in Renfrew County when you look at what has happened elsewhere and elsewhere around the world. I mean, I'm proud of Canada, I'm proud of Ontario, I'm proud of the people in Renfrew County. But at the same time, we don't want to become a hotspot. We don't want to become the next problem. So we can all work together to ensure that we protect one another. And that really is in essentially the message. What am I doing today to protect you? If everybody asks themselves that question, I think we'll all be much better off, and we'll get through this a lot in a lot better condition and a lot sooner. Thank you.
Thank you very much, Minister, certainly for taking the time out of, I know it's a very busy schedule today, to be with us, and also our thanks from Renfrew County to your government, who's doing everything possible as well to try to contain this virus. So thank you again for your time. Now I ask Dr. Fitzsimon to speak as well, please.
Thank you, Warden Robinson. So I want to give a clear and simple message to every parent, every student and teacher, indeed every resident of Renfrew County and the township of South Algonquin, about what we all need to do right now. But at the same time, I want to personally acknowledge that what we are asking is causing hardship and difficulty for many families. However, for the safety of all of our families and all of our communities, we must not let our guard down now. COVID-19 has most certainly not gone away. It's not become less dangerous. It's not become less contagious. And so we have to continue making difficult decisions and taking actions that we would all prefer not to have to take. So you can read the full list of possible COVID symptoms on all the public health websites. But the truth is that many of the common fall and winter symptoms of cough, colds, and runny noses can also be due to COVID-19. We cannot take the risk. We cannot gamble with people's lives by hoping that these symptoms are just a simple cough and cold. So if anyone has any of the possible symptoms of COVID-19, even if they are mild, the person with symptoms must self-isolate and get tested. Household members of the person with symptoms must also self-isolate, but do not need testing so long as they do not develop symptoms. Now, household members can go back to school or work when a negative test result has been received for the person with symptoms. The person with symptoms themselves can go back to school or work when they've had a negative test result and it has been 24 hours since symptoms started improving and they have not had a fever without medication for 24 hours. Now, minor symptoms that we know can persist in children, such as a runny nose, do not need to keep the child away from school so long as a negative test has been received and it's been 24 hours since the symptoms started to improve and they have not had a fever for 24 hours. So to get tested, you need to call the Renfrew County Virtual Triage and Assessment Centre, or VTAC, on 1-844-727-6404. And you can book an appointment at one of our drive-through test sites. And these are taking place across the county. If you are a vulnerable or housebound person, then we will make arrangements for a community paramedic to come to your home to test you. Now, calling VTAC to book an appointment will help us to avoid the long lineups and having to turn people away at the sites. It also helps to warn us early if we need to increase our capacity. Remember, you only need to be tested if you have possible symptoms of COVID-19 or if you have been told by a public health official to get tested because you've been in close contact with a confirmed case. Public health will decide who meets the criteria for close contacts of confirmed cases, and they will contact you if you meet their definition. If you follow this guidance, you will be helping VTAC to get tests completed faster, and you will be helping the labs to process the tests and get results out faster. Quick testing, quick results means that you and your family can get back to school and back to work as soon as possible. And of course, it will mean that we know about any positive cases of COVID as soon as possible. If a person with symptoms of COVID does not get tested, then all members of the household must self-isolate for 14 days from the onset of symptoms. A doctor's note is not required for return to work or school once the criteria that I've just outlined have been met. I know that many people across Renfrew County in the township of South Algonquin are following this guidance. We need everyone to continue to do this. So please do whatever you can to help and support your employees, your teachers, your friends and family to follow this guidance so that your healthcare professionals can provide COVID-19 assessment and testing for those who need it. Thank you.
Thank you very much, Doctor. And certainly VTAC has been essential in the County of Renfrew and South Algonquin at allowing our residents to receive the care they need and the testing they need without clogging up our emergency rooms in our hospitals. So thank you very much for that message. It's a tough one to hear, but it is one that we definitely have to adhere to. Now I'll ask for Chief Nolan to speak, please.
Thank you, Warden Robinson. I think it's important that once people have called VTAC, as Dr. Fitzsimon have identified, that you understand a bit about the process that we have in place so that everybody's expectations are being met through that process. So based upon the criteria that have been outlined for calling VTAC and getting a scheduled appointment to come to our drive-through mobile assessment sites with the paramedics, we have posted a 2-week rolling schedule now for months in Renfrew County. But I think it's also important that people understand that there are additional testing going on every day across Renfrew County. So while we post a standardized rolling calendar throughout Renfrew County, we urge people that if they meet the criteria to give VTAC a call, and they may offer you attendance at one of the assessment centers that is not posted on the schedule that we have publicly displayed at this time. We have doubled our capacity in the past week across Renfrew County. And as Minister Yakubuski's government has been very supportive of us rolling up our sleeves to be able to make sure that you have access close to home for testing across Renfrew County and South Algonquin. So we added in additional testing capacity over the weekend in Renfrew County. And beginning tomorrow, we have doubled up our testing capacity. So paramedics are now greeting hundreds of people every day across the county to have access to this testing. So once you have a scheduled appointment and you arrive on site, you'll be greeted by paramedics and explain the process. We're asking people to have their health card as well as their driver's license or some form of identification that has their home address. The reason that that's important is that we want to make sure that all of your documentation is correct before it goes to the laboratory. If there's a spelling mistake on your address, for example, your sample may be rejected or you may not be able to follow up on that swab. So that's why we're asking for identification. Next, you'll move up through the registration process. We will have your requisition done as you arrive on site, and you will be swabbed by a paramedic. And in some cases, the staff from public health have been working with us very well to make sure that people are moving through this process quickly. So if, for example, you're scheduled at 10 o'clock in the morning, that is when you arrive. You will be put in a queue. There will be a wait for you to be registered and to be swabbed, but our goal is to have everybody moving through in 30 minutes or less throughout the county. In doing that, we know that our swabbing centers are open for roughly 6 hours a day. We have multiple swabbing centers occurring throughout the county, and we're also in the process of winterizing this process. You'll note, we've not asked anybody to come and stand in line, come into an arena, or to even just get out of their cars. We keep everybody in their vehicle. You drive up, you stay in your bubble. We get your specimen by putting a swab to the back of your nose, and you drive away. And that process is working for both adults and children alike. We're swabbing people over the age of 2 throughout the county. We know that we have capacity in the system, and some of you may have seen over the weekend, the Premier's office, Minister Yakabuski and his team have asked us to flex into Ottawa and use the Renfrew County model for mobile pop-up assessment centers. And we were able to assist the City of Ottawa by having paramedics from across the region swab over 2,750 people using our mobile assessment center. So I'm very proud that the innovative spirit that is alive and well in Renfrew County is being recognized by other jurisdictions. And we hope that over the coming weeks and months, we can all remember to be kind, to be diligent, and to help keep not only our families safe, but I'm also asking you to help keep healthcare workers, first responders, and essential workers safe by heeding the advice that the physicians on today's call have provided you.
Thank you very much, Chief Nolan. We've always been extremely proud of our Community Paramedic Service Month. Even more so now, we're watching you evolve into something that is absolutely incredible with the VTAC, assisting our neighbors in Ottawa as well. And hopefully it'll be the beginning of a long positive relationship with VTAC and the County of Renfrew. Thank you very much. And please let your staff know how much the residents of the County of Renfrew appreciate all of your work. Ms. Martin, please.
Thank you, Warden Robinson. The Algonquins of Pikwakanagan First Nation is committed to continuing to work with the Renfrew County District Health Unit, Ontario Public Health, Health Canada, and of course Renfrew County VTAC to ensure that the community stays safe and that the guidelines are communicated across the county. We will continue to follow all of the public health guidelines as we enter into the second wave, and we're going to ensure that our community and any visitors to our community do stay safe. We have a mandatory masking at all of our businesses on the First Nation, and that has been in place for many months now. So if anyone is planning on visiting our community, please follow all of the public health guidelines that you would be following anywhere else in Ontario. Our emergency response control group is going to continue to meet as necessary to ensure that our approach to the second wave evolves based on the most up-to-date information. And so that will involve ensuring that we are at the table with everybody that is on this call and continuing to be at the table, especially with the Renfrew County District Health Unit and VTAC. We want to make sure that we are implementing strategies in our community that mirror the ones being implemented in Ontario to ensure consistency and to help prevent the spread of COVID-19. Thank you.
Thank you very much. And we certainly appreciate the message from our neighbors as well. Mayor May, please.
Thank you, Warden. Good morning, everyone. What I'm about to say will largely echo what the panel has been saying, but it is our hope that we can emphasize how important it is that we remain vigilant at this time. Here in Pembroke, we had an eye-opener last week with positive cases of COVID-19 at Fellows High School. An important reminder that we are still very much in the middle of a pandemic. I am so grateful for the actions of Dr. Cushman and the school board for decisive, quick action to keep our students and communities safe. Students, staff, and teachers at Fellows and all other schools, I know this is not easy for you, and we thank you for your cooperation. In order to keep everyone safe, we must follow the directives of the health unit. Wash your hands, practice safe social distancing, wear a mask, keep your bubble small, and if you are sick, please stay home. With that being said, patience and compassion are essential for us to get through this together. Check up on friends, family, neighbors, and colleagues. Offer assistance in a safe manner. And do not jump to judgment when you see someone without a mask. We now know how much this pandemic has hurt our local businesses. So please remember to support them. Shop local when you can and take advantage of some of the safety measures local businesses have worked tirelessly to implement. We've been going through this for over 6 months now. And because of our vigilance, we have managed to keep our cases low and our community safe. But as Dr. Cushman and Dr. Fitzsimmons have said, we must not have COVID fatigue. As we have seen, things can change quickly if we are not as careful as possible. I know this has not been easy, and I want you to know that we are not near the end of this. So we must follow the directives of the health unit and remain vigilant for the health and safety of ourselves and our community. Thank you.
Thank you very much, Mayor LeMay. Thank you to all the panel members today for delivering your important messages. And I would like to thank the residents and the media who are watching us online for taking the time to hear from us. I would ask that residents continue to be vigilant about their safety and those around them in these difficult times. Please be assured that the County of Renfrew, along with all the local municipalities and the Renfrew County and District Health Unit, continue to work collectively to ensure that all measures are being taken to protect our residents, staff, and visitors during this difficult time. Please continue following the directions of the Renfrew County and District Health Unit, the provincial and federal governments, so that Renfrew County and its residents can get through this second wave and hopefully return to some semblance of normalcy in the days ahead. Thank you very much. Stay safe and be kind.